Hello, I'm Ollie Morris. I'm a GP working in Southampton.
And I'm Sally Hinder. I'm a health visitor in Farnborough.
And in this short video, we're going to be talking about fever, one of the commonest reasons for being concerned about a child's health. I think most of us are pretty comfortable with recognising a child with a fever, so they're hot and bothered, looking a bit uncomfortable, and clearly something else going on with them. And most of us, I think, can tell the difference between that child and a child that's just got hot and flushed and sweaty from running around a busy play area, which just goes to show that it's not right down to the temperature, it's the overall picture of the child that is different when they've got a fever. So the precise numbers or the temperature you record for a fever is not necessarily the most important bit about the fever, it's more about the overall picture and what else is going on in the child that helps you make a decision as to how concerned you are. And in most cases, the numbers don't matter. There are a few exceptions, and we'll cover them a bit later on. But really, it's probably good enough to say your child looks hot and you think they're unwell. Back of the hand on the forehead can feel that they're hot. But if you want to measure a temperature, just make sure you use one of the recognised methods that's going to be reliable. So a digital thermometer, electronic thermometer under the armpit is pretty good for most age ranges. You shouldn't use thermometers in mouths, really more particularly for young children. And some of the sort of infrared ones on the forehead and the tapes don't work so reliably. So just use a reliable one as advised by the NHS website. But what you can expect with the child is that they're going to have a temperature that goes up and down a bit in the first few days of the illness as their immune system works to beat off whatever's causing the illness. And when they've got a higher temperature, they're going to be looking a bit sorry for themselves. They'll feel hot, or be a bit flush, a bit less interested in doing the things they normally want to do, maybe wanting a few more cuddles and being a bit clingy. And we're all familiar with what that looks like. And usually the fever will settle down after a few days, and certainly a fever that's going on and on, that's one of the reasons that you might want to get them checked out, as we'll see later. So much for what we mean by a fever. Essentially, it's when we measure a temperature and it's above 38 degrees centigrade. What can you do for a child when they've got a fever?
So as Ollie mentioned, a fever in itself isn't something that we need to treat because the fever isn't particularly concerning on its own. It's about the whole picture of the child. You might be concerned about whether your child is going to have a fit or a febrile convulsion if they have a high fever, but what we know is that the fever doesn't necessarily correlate with the likelihood of a child having a febrile convulsion. There will be some children that are more likely to have them, and certainly children that have had them before may have them again, but bringing down a fever in itself is not going to prevent those seizures or the febrile convulsions from happening. What we tend to do instead is treat the child, so make sure that they are comfortable. So rather than using any medication to bring down a fever, we might use something like paracetamol or ibuprofen so that a child feels more comfortable. They might be a bit more settled, they might be a bit happier, more willing to play, and they'll generally pick up when their temperature isn't so high. And that's more what we're looking for. We're looking for the child feeling a bit more well, rather than specifically whether the fever is going down or not. Some people may have used tepid sponging or sweating a fever out before. That's not something that we advise anymore. What we suggest is that making sure that your child is taking fluids, plenty of fluids, and that you are only covering them up with a suitable amount of clothing. So don't overdress, don't underdress. If they need to only be in a nappy and a baby grow, that's absolutely fine as long as they're comfortable in themselves. And you might be wondering whether your child should stay off of school or nursery because of a fever, and that would be more about, again, their symptoms with the fever. So they're likely to be particularly feeling a bit rubbish, wanting rest, wanting cuddles, wanting a bit more attention. And so it might be a good idea in that case for the child to stay at home until the fever settles. But there will be some illnesses and infections that may be passed on at nursery where we would suggest that you keep your child off until that has passed.
So that's, I think, probably at the bottom of most of our minds. Our concern, we've got a child that's hot, is we know that most of them are going to be absolutely fine. Fever is very common, particularly in young children. They've got lots of illnesses, and we kind of know that it's just a matter of weathering it and keeping them comfortable. But I think we're all anxious about missing the child that's got something more significant going on and that really does need some extra help and support. So how can you identify those children as a parent or even as a healthcare professional? So I'm just going to share the Health Together website and we'll go through some of the features there. So this is using the red, amber, green system. And most of these symptoms, particularly in the red zone, are ones that you probably would have picked up anyway. And if that happened to your child in the context of a fever, you'd probably be calling 999 or taking them straight to ED anyway. But they are written down here just to reassure you that's absolutely the right thing to do. So the sort of features there we've already mentioned, Sally's mentioned about having a fit or a seizure. If you have a seizure with a fever, that child needs to be assessed urgently. It may be after they've been assessed that we work out that that was a fever fit or febrile convulsion, in which case you'll be advised how to look after them in the future. But the first time that happens, certainly they need to go straight to hospital. Other features might be if they're really having problems with their breathing. So they're either breathing very, very hard, putting much too much effort into breathing, such that they're too breathless to feed or drink or talk, or that they're getting so little oxygen into their body that they're going blue around their lips, things like that. They're obviously very concerning signs. If the circulation is really struggling, so that the blood's not being pumped around the body effectively, they might go very grey or ashen coloured. The skin can get blotchy or mottled, and they might feel actually surprisingly cold to the touch. Those are all concerning signs. And I think we're all know now about the glass test and the rash that doesn't go away when you put pressure on it. That's a very particular condition that needs urgent assessment in hospital. And this is where we get down to particular temperatures do matter. So if you've got a child under 3 months of age, a young baby with a temperature of 38 or above, that child needs to be assessed in hospital. It's not necessarily that they're going to be very seriously unwell, it's just that the risk of it being a more significant illness is higher and they need the assessment that really only hospital can offer. So that's one absolute cutoff you can remember, that 38 degrees in a child under the age of 3 months. And finally, it might be that they're just not behaving so abnormally or really difficult to wake them up that actually you're worried about their consciousness. So they're either very confused or they're very difficult to wake up or keep awake, or they're exceptionally agitated with a strange cry and you can't distract them or console them at all. That could be a sign of something serious going on and you want to get them checked out in hospital straight away. Then we move on to features that aren't as concerning as that, but do probably need a little bit more thought and some discussion with either a doctor or a nurse as to what to do and what's the appropriate course of action. So that might be that you are concerned about their breathing, not as much that you think they need help straight away, but you're just not comfortable that it's normal. Then you could talk with them, so they're finding it hard to breathe. If you're worried about the fluids, so they're just not taking fluids as you'd like, they've not passed urine for 12 hours, you're worried they're looking a little bit dry, then that'd be another reason to get them checked out. If they are, I mean, all children with a fever, as we said, are going to be a bit uncomfortable, a bit clingy, wanting to sleep a bit more, and that's perfectly normal. But if they're really just sleeping, not sleeping more, but it's very hard to wake them up, or they've really got very little interest in their surroundings, or they're particularly irritable, then of course that's concerning. And you might be saying, well, is this a red feature or an amber feature? It's hard to tell. If you're not sure, discuss with a healthcare professional. If they have very extreme shivering, so they're shaking very hard, that can be a sign of significant infection, or they're complaining, if they're an older child, of actual pain in their muscles. And then we've got another temperature cutoff. So this is for children up to the age of 6 months. So up to 6 months, if you've got a temperature above 39, you're probably going to need to be assessed. And so you should call a doctor or a nurse. Obviously, if it's the under 3 months, they definitely need to go to hospital. And finally, I said earlier that usually fevers settle down after the first couple of days of an illness. So if you have got a temperature above 38 that's going up and down, continuing more than 5 days, that's another reason to get them checked out. And the bottom line is that if you're really not happy having read through this, looked at this video, or the child's getting worse, you're still worried, again, just call someone and talk it through with them. But if they've got none of those features, hopefully by now you'd be quite confident what to expect and what you can do to look after your child.